2:30. Welcome to Cook County Health Department Schools and COVID-19 Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department, and I am your moderator and facilitator for these meetings. So we'll go through announcements pretty quickly, and then I will toss it over to Lex for your update. Our meeting objectives are to provide updates and support to schools while navigating COVID-19, answer any frequently asked questions, and provide CCDPH contact information and resources. Couple announcements. As most of the people who've been with us from the beginning are aware, but for the people who are new, we have changed our schedule at the beginning of the year. Our meetings are bi-weekly now instead of weekly. If we see that there's a need to increase our meetings back to a weekly basis, we will let you know. But so far, everything seems to be settling down, so we will remain at a bi-weekly level. All of our webinars are recorded and they're uploaded to our CCDPH website as well as our CCDPH YouTube page. So if you want to reference anything that we've said in the webinar, you can go back and reference the recordings once they are posted. We begin promptly at 2:30. Please keep your line muted. The chat is disabled during the presentation. We want to make sure everyone is paying attention to the presentation, as well as your question may be answered during the presentation. I'm asking everyone to confirm that the email address they registered with is correct. When I send out the slides, I get quite a few incorrect emails returned undeliverable, so I want to make sure that everyone gets the information. Here is CCDPH contact information. If you need it, the CCDPH COVID-19 general email address for webinar related questions, general questions, CCDPH communicable disease reporting email. That's where you can send your line lists, report communicable diseases and any metrics questions. Our general website, our school-specific website, which is /school-health, our COVID-19 website, and then the very last link is printable and downloadable materials that you may be able to use in your organization. I am the EpiPen coordinator for Cook County Health Department. We participate that, and you can request EpiPens from your schools. It has to be, the request has to come from a medical professional or has been trained on the administration of medication. All requests must be typed and scanned into me. That way we can legibly read it and there's no room for error. So what happens is our doctor will sign a completed standing order and an EpiPen prescription, and then it is up to the schools to fill the prescription at the medications that the school has. I know some people have reached out because they weren't sure how to fill the prescription. We don't have any places that we recommend, but a lot of people have experience with EpiPensForSchools.com. I know that some people have told me that their website may be down, but please check out that resource. And a lot of people have had experience with filling prescriptions through them free of charge. If you're interested and know someone is interested, you can get the free COVID-19 test sent to your house at covidtest.gov. Alternatively, you can go to your preferred pharmacy and you can have them run your prescription and then pick up the COVID test that way. Cook County Health Department participates in the Rapid Antigen Bionex testing program. All information is found at the website at the below of the page. If you have any concerns about a testing site, you can call the Illinois Attorney General's office and make a complaint. The number is at the bottom of the screen. I don't know if you've been following the news. There have been a couple COVID sites that have been shut down for impropriety. So please use that phone number if you have any issues with a COVID testing site. If you're interested in setting up the Shield testing through IDPH, IDPH's email address is listed on the slide, and Beth Heller can help you set that up along with her team. We are currently right now having another COVID testing site at Leak & Sons in Country Club Hills. It was very successful the last 2 times that we had it. It is running today and tomorrow, 11 a.m. to 5:30 p.m. And here's your slide also in Spanish. We are also co-sponsoring an event Saturday, March 12th. That's next Saturday in Melrose Park. Free COVID vaccine as well as other resources. Transportation is also being offered to that event. If you would just like to go to our Oak Forest COVID testing site, we have opened that probably for the next month or so. Just it's an outdoor testing site. You can also do your vaccines and your testing at this drive-through location at the former Oak Forest Health Center. There's a flyer also in Spanish as well. You'll get all of these slides when I send out the information after our webinar. And also here's a list of all of our Cook County clinics. If you prefer to go to any of these, this needs to be edited as our mass vaccination sites have been closed. They were opened right around Christmas when the rates got really, really high, and they've since been closed as the rates have decreased. Here's the calendar events of upcoming events that we have going on. This is just a little snippet. If you go to our Cook County Health Department calendar, you'll see all the events that we have that we are sponsoring as well as co-sponsoring. I sent this out previously, but I think that it is a great opportunity for schools or families to utilize this free mental health program through NAMI Chicago, National Alliance of Mental Illness. The slide will also be sent to you during the webinar, after the webinar, my apologies. If you're still interested in having a school clinic at your school, you can contact the information on the slide and they can be glad to help you out with that. Just information on how to host your event and tips, more educational resources, as well as our My Shot campaign on YouTube, just to show us out and about in the community and what people have to say about that. If you would like to have a speaker come to your organization to speak about COVID-related issues, you can apply at the Google Doc at the bottom of the screen. As we said before, if you or you know someone who's having issues getting a ride to their vaccine appointment, you can call the destination vaccination phone number and they can set that up. We are also able to offer in-home vaccinations for people who are homebound, as well as those people living within the home with the person who is homebound. So please register at either call the phone number or the website below. Thank you very much for your time. I'm going to stop sharing and then toss it to Lex so that she can give you your update. Hi, Lex. How are you?
Good, thanks, Kelly. All right, so we have good news. It is something that is a change for all of us, and I know that can be hard to deal with, but it's a change in the right direction, so I'm excited to talk about it. We've got some housekeeping, metrics update. I'm going to go through the new metrics that CDC set out last week, give you some more travel guidance, go over what's new, where we're going from here, and we had a couple of questions submitted, so I'll get to those. You guys know the drill with reporting. I think we've all been pretty good about getting back to you as quickly as possible. As a reminder, please put a very specific subject in the subject line of the email, just since so many of us tackle different things in the email. And then as we get into metrics, I don't know how many of you use this, but the school metrics tab of the Cook County COVID app, where we display all of our metrics, is going to be removed because school guidelines will be determined by the community data, as has been described by CDC that we'll talk about, but that's all stuff you can find literally on the first tab right when you click into our data resources. So you'll still have access to that information, but the tab is being removed because we don't need the same information twice. If that's going to be an issue for the way you guys operate, when the chat opens up, please let me know, just so that I can let our data person, Kelly, not Kelly Jones, different Kelly, know, so we can gauge how useful that actually is to most people. All right, so this is a busy page, but we're going to go through. As you probably well know, the CDC released new metrics last week, and how that impacts their new recommendations for mask guidance, which obviously impacts all of us. And basically what the new metrics do is take severity more into account. It's just a more nuanced look at transmission, which is great because it's been pretty well established that Omicron is less severe for most people who are young and healthy, and especially if you're vaccinated. So we also needed to take into account, besides the case count, hospital admissions and the number of inpatient beds that are actually occupied by COVID patients. So that's 3 considerations when we decide how we're going to be dealing with our recommendations. And right now, Cook County is in the category that's considered low. If you guys want me to get into the numbers the next time we talk, I can, but we have it clearly labeled on our data page what level of transmission we're in, and also you can look by county on the CDC site, but I did notice they didn't have a section for Chicago, so I'm not sure if they're lumping us and suburban Cook in with Chicago in their categorization. Either way, we're in low, which is still great. But I'll have to contact them and double check. But what it means to be in low transmission is that the best way to protect yourself is to stay up to date with your COVID vaccines. I mean, that's true for everybody. But stay up to date, and then for people who have symptoms, to get tested. It doesn't mean you have to wear masks indoors for the most part, which is great. So that's in low transmission. If we go up again, which hopefully we don't, then there are a couple more precautions we have to take, especially if it's someone who's at higher risk of illness or maybe can't get vaccinated because they have some kind of medical issue where they can't. And then for high, that's when we would go back to indoor masking. So hopefully we don't get back up to high. There are some parts of the country that are still there, but lucky for us, we are in the part of the country where we are currently in low transmission, taking severity into account. So that's really wonderful. That's a great change. I do want to emphasize, you can still choose to mask, and it's still recommended to protect yourself. People with symptoms, anyone who tests positive, and someone who's in quarantine should absolutely still be masking. This is just general recommendations for how to operate your school, your building, your business. So you can still choose to wear a mask. I personally will probably still be wearing a mask, like when I go to a pharmacy or the grocery store, because those aren't places that immunocompromised people can avoid, and I want to be considerate of their health. But it's not, required. That being said, here are what our metrics look like by date. As you can see, the last time we talked, I had a line going from our peak last winter to this winter, and we were about where we were last winter, and we have dropped below that. We are not where we were last summer, but we are heading in the right direction. It's wonderful. My life is much easier. So this is really great, and hopefully we continue to trend this way now that we're removing masks in a lot of scenarios. And again, this is what you'll see when you look on the first page of the COVID metrics website for Suburban Cook. We are in low community transmission, and also we've kind of cut our number of active school outbreaks in half, which is really wonderful. The state has and Cook County has, so wonderful job, you guys. Keep that up. I love to see it. And we've also, in addition to dropping to this low community level, it breaks it down by our case count that you've gotten used to seeing, and then we have hospital admissions and hospital beds. So, all good. There are a couple of states that are safe to travel to if for some reason you can't get vaccinated. And also we would be considered yellow, which is big news. I mean, we're kind of on the border, but we're there with Ohio, Nebraska, Maryland, and a couple of territories. But Ohio's not that far if people wanted to spring break. So there are a couple of places, and I'm sure lots of states will be following suit soon. The travel guidance hasn't changed all that much. If you're up to date on vaccines, self-monitor. You're in a good position. You'll have to provide proof of vaccination if you're traveling internationally, but otherwise, if you're traveling domestically, just be cognizant of local rules and wear a mask if you're on public transportation, because that hasn't stopped yet. And then if you've got someone who's not up to date on vaccines, they should get tested after they return. But for students who obviously mostly this chat is about, they can return to school the next day, even if they're not up to date on their vaccines. But they should get tested 3 to 5 days after. And of course, self-monitor for symptoms. And that the same goes for international travel. With spring break coming up, I don't know how many cruises there are going to be, but I think my great aunt is going on a cruise soon. Try to avoid cruises of any kind if it's absolutely something the family's going to do. Really emphasize that they should be up to date on their vaccines. That's going to be the best way they can protect themselves. And then they should follow testing procedures and test after they return. So that's all the travel guidance with spring break coming up. And then getting to the big stuff, what is new in our guidelines? So, masking is no longer required as a mandate indoors for schools, but it's still recommended. There's good science behind why why masking is so effective. It protects others and it protects ourselves, especially because schools are places where you're going to run into elderly people who may be more at risk, pregnant people whose immune systems aren't as effective because they can't have their body attacking the baby, people who are being treated for cancer or have immunocompromising conditions or autoimmune diseases. So it's still a place where we have to protect people, especially when the vaccination rate isn't as high as we'd like to see. But it is not something we are strictly enforcing in schools. It's still recommended. I'd still like to see good conversations about it, but that's where we are. Great news. And we're only going back if we get really high transmission or on an individual level. Hopefully there's no massive outbreaks anymore, but if there are, we can talk about masking in those situations. The people for whom masking is still required are people who are returning because they were symptomatic, people who are close contacts and are returning from quarantine, and then people who are returning from isolation. They still have to mask in the school setting. This is required if they want to return early through the full 10 days. If you're worried that they're not going to do that, we can provide an order in those scenarios. A lot of people, even though this is now more of a voluntary thing, have been totally fine following it. But if you have any issues, talk to us, obviously. Schools can still require masks if they want to at the district level through board policies, collective bargaining, through dress code. If you're operating a school where a lot of people are at higher risk of severe disease, or you have a lot of people who can't mask well, you may want to require the people who can mask well in those settings to continue to wear masks. That is up to you to decide, but we will support you in that decision. Obviously, we want to protect people who are at risk. So, other news, now that we are in low transmission, we are going to allow symptomatic people to return with a negative antigen or PCR test result. So now testing should be more accessible for everybody, but I do want to talk about the antigen testing algorithm before we celebrate too hard. And I do want to clarify also, this is not home tests. Home tests do not return symptomatic people still, because there's just too many variables going on with home tests. I think my brother spilled orange juice on his test and it got really wonky. That happens. So we'll talk about that in a second, but that's great news. It should be more accessible, should be a quicker turnaround time. And then also, CDC is no longer requiring people to wear masks on buses or vans operated by schools. And that includes daycare or early education. That could mean you've got a bus going to another school full of soccer players. They don't have to be masked while they're on that bus. You can choose to require masks in those situations, like a high-risk sport like wrestling or something like that. But it's no longer required. The guidance for all of this, for IDPH, for CDC, is in the process of being updated, but this is all in place as policy at this time. It might be hard to find in writing. Some pages just take longer to update. So that's all the new stuff for that, but I want to talk about antigen testing. This is brand new, so I'm hoping we get a little bit more information on this in the days to come. But I want to specifically talk about antigen testing for people who are symptomatic. So it looks like what CDC is recommending now is that you can return with antigen testing, but you need to take 2 of them before you return. 48 hours, 24 hours ish apart. And then that is the way we are trying to combat the risk of returning someone who's symptomatic when most of us aren't wearing masks. So that's going to be really important. I don't know, I can't say for sure if we'll be accepting singular antigen test results or we'll need that 24-hour to 48-hour serial antigen tests. Hopefully we get some clarification later this evening, but stay tuned for that. We are tentatively taking antigen tests. So that is good news. I just wanted to give you a heads up that they changed the testing algorithm and we're waiting on a little bit more interpretation for people who are symptomatic. All right. I also want to talk about the next couple of months and the beginning of next school year. You've probably heard the endemicity model tossed around or endemic tossed around, and if you were even able to take an epidemiology or public health class, it's probably been a while. So I want to go over what this actually means. We're trying to make guidelines to live with COVID as an endemic disease because we've realized that it's not something that's going to be easily eradicated. So endemic COVID-19 means that we still have the virus circulating, but not in such a widespread manner, where there are huge outbreaks like over towns, over counties, over states. There will still be small outbreaks to deal with in long-term care facilities, maybe in schools, but with vaccination and other measures, the chance of actually encountering the virus will be low. And so it's not going to be a complete return to how it was before the pandemic. We're still going to have guidance for these scenarios, but it will really resemble how it was before the pandemic. So we're getting there. That's the endemicity model. We're not quite there yet. We've still got a bit to go, and we need to see how removing masking goes because even if it's not COVID, it's been a while since we haven't been masking, and a lot of us haven't been exposed to common bugs that get passed through schools in a while. So we might get hit with some bad colds or some bad stomach bugs. Now that we're being a little bit less cautious. So we need to keep an eye on that. And there's still a lot we don't know that would pertain to the endemicity model. So like, is COVID going to have a seasonality like the flu does? Where is it just going to be a winter thing? We don't know yet. Are we going to have to get more boosters for different variants? That's certainly possible, and I believe the Biden administration set that out in their new COVID plans as they're getting towards this endemicity model to be able to produce those vaccines for variants really quickly. But I do think that, and this is just me being a huge infectious disease nerd, when we look back at the 1918, 1919 flu, we got to a point where after a few years, the variant was a lot less severe. A lot more people had immunity. And so we got to a point where we just kind of live with it. And if you've got a really old grandparent, they may have antibodies for it because the population just learned to live with it. And we don't know for sure, but Omicron may be a step in that direction, which would be really wonderful as we head towards this endemicity model. So that's where we're heading. There's a lot we don't know, and so it is going to be important to keep staying tuned in for these webinars so we can keep you updated on what the recent guidance is. But it is guidance in a good direction. It will just be new information to learn, but it's not going to be scary, restricting pandemic stuff. Where we are right now, it's still going to be really important to continue to follow what we've been doing. Masking is effective. All of these measures have been informed by really heavily researched science. Like, they've all got several studies to back up these recommendations. So the best protection is obviously to stay up to date on vaccines. We are waiting for peer review of a study that came out that said vaccines in younger children may not be as effective. So we'll stay tuned for that. But obviously they still offer better protection than nothing. Close contact is within 6 feet when unmasked for the unvaccinated. That's not changing because the 6 feet figure is based on how far viable virus can travel out of your mouth when you're talking, coughing, singing, things like that. So the 6 feet isn't plucked out of nowhere. It's how far we've measured people's spit droplets basically to go. Contact tracing is still really, really important when we're easing other restrictions. We need to be able to keep people who may be infectious out of school. It's still required by Illinois law, and that's not impacted by the emergency orders. Contact tracing for diseases that happen in schools has just been a part of our communicable diseases code for a really long time. So that's still really important. I encourage your districts to continue to contact trace. It's so important in these small congregational settings. You know, it's really important because over 30% of cases are still infectious after day 5. So it's important to masks. And a study that came out about the NFL showed that a lot of close contacts, especially in the sports setting, convert to cases. It really depends on the type of close contact, but it's still really important to know who the close contacts are. And also we know Omicron just burns through households. So it's still going to be really important to be keeping track of cases and close contacts. So that's still an important aspect of this. And again, if you're thinking that a close contact or a case are going to be unsafely returning early, we can help you through that with an order. That's also important. And then I've left links so you can look up that administrative code that's just been standard Illinois law for a while, and then also what we do for other diseases. So like fever, diarrhea, vomiting, that is something you can always exclude people for. Those are usually infectious in origin. So that's important. And then I do want to also mention that IDPH is working with ISB on clarifications on what will be required from schools and also consequences of not following really good public health recommendations. So stay tuned for them. I know it's a process to get things approved. We're still waiting on that decision tree, I think. So stay tuned for that. But the usual stuff that we've been doing is still very effective and very important. All right. Since masks are no longer required, how do we keep everyone safe? So the first thing I want to say is that the health center or the nurse's office in a school, that's considered a healthcare setting. And school nurses, PT, other staff, they're also considered to be healthcare personnel. So in those settings, and those people still need to be masking with the best masks that they have access to, because they're going to be the people coming into contact with COVID more often. So that's still a place where masking needs to happen. Encourage masking, like I said, and keep contact tracing within schools. You know, keep seating charts, classroom setups, try to arrange classrooms to keep kids as distant as possible, pending the space. I know that's not always possible. Ventilation as we head into warmer weather, get those windows open, get air circulating. Try to set up the lunchroom so that kids are far apart. And then also, I just wanted to remind you guys, IHSA sports and activities still have masking requirements for competitions until they take that down. But as we're heading into spring, we've got more outdoor sports, so we won't have to worry about it so much. All right, last thing, submitted questions. Kelly, go ahead and open up the chat. First question is, now that a lot of schools are moving to make masks optional, I'm wondering how we should manage the higher risk activities such as chorus, band, PE, and sports like basketball. We have our students spaced out to 3 feet in classrooms, which is sufficient when they're masked, but how should we handle the non-masked students? So, like I just said, follow IHSA masking rules for any extracurriculars. But for curricular stuff like chorus or band or PE, masking is still recommended. Continue to recommend masks. PE should still be making, lesson plans for activities that involve as little close contact as possible. And for wind instruments, they should be spaced as far apart as possible. Don't allow people to empty their spit valves of their brass instruments near others or onto the floor. That was already a gross thing before the pandemic, and way back when I used to be in band, it should not be happening during a pandemic. So those are my recommendations there. And then it's really great if you can have your classroom spaced out 3 feet, but you're just going to have to know through seating charts and things like that who could have possible close contact. Second question, with outdoor recess and gym, could we open up our water fountains for students' use? Yes, absolutely, they should have access to water, but remind them to have good hand hygiene before and after. And just thinking about my baby cousins, do not let them put their mouths on the actual fountain. Encourage water bottle use over water fountains, but absolutely make sure they can get a drink during recess and gym or after recess and gym. And then, are we still following guidelines for symptomatic students and staff? Yes, symptomatic students and staff, and we're talking about people who don't have any known close contact, should get tested with PCR or antigen before returning, or stay home for 5 days and then mask up upon returning. If they refuse or they can't follow these guidelines, they can return once acute symptoms subside, and that cannot be within 24 hours of fever, diarrhea, or vomiting, as you guys know. And then last question, which kind of sparked the biggest part of this presentation, when will the school guidelines be lifted? They're not going to be lifted, but changed is probably the better term, because we're going to have to learn to live with COVID as something that circulates at a much lower level than it does now. But we still need to protect people. So things will change, but we'll have a lot more freedom than we have had while it's been raging. All right, I'm gonna stop sharing. Oh, and as usual, I have references in case you guys need to look at the isolation guidelines, some handy charts, things like that. But I'm gonna stop sharing and take a look at the chat. Can you please clarify, IHSA rules do not require indoor masking? I haven't looked to see if they updated their sports guidelines. For the actual athletes, if they haven't updated things recently, then they do have to, sorry, I just got a couple of messages in a row. They do have to mask per IHSA guidelines, the athletes, but if you've got spectators and we're in low transmission, they do not have to mask. I'm not sure who that was for, but you may have some people masking and some people not masking. Looks like we have a question to look back at the antigen algorithm. Yes, I will. Bear with me 1 second. I'm going to share my screen and go back to it because I know that's a little confusing. Okay, so we don't have all of the details yet, but for someone who's symptomatic, without any known close contact, we've started to allow people to return with a negative antigen test. But the new antigen testing algorithm from CDC is suggesting that a confirmatory test following the antigen test, either a PCR or an additional antigen test, be performed before someone returns, and that would be within a day or two of that initial negative antigen test. So we're waiting for clarification. This is, hot off the presses stuff. But pending what they say about this algorithm, someone might need 2 antigen tests to return if they're symptomatic, instead of just 1 negative. But we will let you guys know if it's 2 instead of 1, don't worry. So we're waiting on clarification for that. But this is the new algorithm. It's just because we're hoping, and I believe Biden said this in, or not him, but his spokesperson said this in their new COVID plans. We're trying to throw a lot of tests in to everything to mitigate the risk of removing masks and having a little bit more freedom in that way. Let me stop sharing and go back to the chat. In recommending symptomatic students and staff get tested with PCR or antigen before returning, what symptoms are you referring to? So I'm referring to COVID-like symptoms, that list that's in the old decision tree, which is because of the nature of COVID, a lot of symptoms. It's basically anything but the sniffles. If a student had a mild sore throat without any other symptoms, are you recommending we send the student home for testing? This is where you guys as health staff get to use your discretion. If it's like very obvious this student was running outside in the cold and now they have a sore throat, you don't have to send them home to get tested. But if you can't immediately see that there's a direct source that's not COVID, of the symptoms in question that are COVID-like, then yes, they do need to get sent home still for testing. Can you clarify, how will you share the decision in the algorithm? The same way we send all this stuff out. Or you can email us if you've got a situation where someone wants to return with an antigen test. Can you clarify? It was our understanding that masking is no longer recommended in indoor settings in the low range per CDC. Mandates are no longer recommended. Masking is still a good idea because there's still a chance for you to encounter the virus, in the wild, in the community setting. And especially in places where like you're picking up a prescription from the pharmacy, you've got a higher chance of running into someone who is either more vulnerable to the virus or is sick with the virus. So it's certainly an individual choice for a lot of people, but people who are higher risk should know to wear a mask to protect themselves. So it's still recommended, but it's not required. You do not have to enforce it. But especially, with us still being in flu season even, it's still important. Can we test symptomatic students with an antigen test instead of sending them home from school? That is a great question. It is something we are having conversations about. We're not there yet, but I will have an answer for that hopefully by the next time we all meet. We need to make sure that the metrics support making that kind of decision with a test for someone who's symptomatic in the school setting. At this very moment, can we accept one antigen test to allow a student back to school, or should we wait for the results? Michelle, you can butt in here if you want to correct me on this. We have started to allow people to return with one negative test this week once we hit low transmission. So I would support staying in that category until we have to start accepting two. But certainly butt in if you disagree.
So we're following IDPH guidance, which have not updated with the new CDC antigen algorithm. Is the new CDC algorithm is something I asked Lex to add just in case that it doesn't, I guess, kind of surprise us later on if it is something that IDPH decide to follow. And the way I see it is chances are we could let every student back with the one antigen test, but we might recommend another one within 48 hours for a symptomatic student just to make sure they still stay negative. So it might have minimum effects on the schools.
So the short of that is one is fine until it gets updated, and we'll let you know when it gets updated. If you email us, we will let you know. Otherwise, we'll send out, stuff to everybody who attends these webinars. And it looks like someone asked, can Binax now at school be the second test? I don't have an answer for you yet, but that's probably going to be a good standard procedure to have in place. But again, hold off on that until we know for sure, until IDPH says that they're going to adopt these recommendations. And then what is IDPH's recommendation regarding indoor masking at schools? Is it a good idea or is it recommended by IDPH in schools within areas that are low? I'm not sharing my screen right now. We've put out a statement, I think 2 weeks ago maybe, about masking in schools. Still being a recommendation. it's not a requirement. It's not, you aren't listening to health experts if you don't do it. But it's still, so I guess it's both a good idea and a recommendation. There's no legal ramifications if you're not requiring it, but it is a good idea because you'd be protecting more vulnerable students and staff who might not be able to get vaccinated or who aren't well protected by the vaccine because they're pregnant or because they're immunocompromised and taking steroids for something like that. So it's still a good idea. It's still being very considerate of other people's health conditions. And then follow up to that, do students need to wear a mask on the school bus? They don't. If you, as a district or school, would be more comfortable if they did, you can require it, but CDC is no longer recommending it for school buses and like school vans and stuff. It's still required on regular public transportation, like when I take the train into the city. All right. With so many students presenting with cold and spring allergies, parents are getting increasingly impatient with us, sending students home. I understand. How to navigate these symptoms. So my recommendation first and foremost is if you know someone's got allergies, or I guess not you as the school nurse, but remind parents that if they know their kid has spring allergies, get that documented so you don't have to send them home for the allergy symptoms that they normally have. So that is the first thing I would do. And the second thing is, until we no longer have to send people home because there's a high probability that symptoms are due to COVID and not something else, then we don't have to. But right now, while we're in low transmission, we're kind of in this in between of if someone has COVID-like symptoms, there's still a good probability that it's due to COVID, but especially as we're hitting spring, there's also obviously a good probability that it could be from allergies or strep throat or things, or just regular common cold coronaviruses that are popping up now that we're not masking as much. Until we get to a point where we can say that's probably not COVID, you're going to have to keep sending kids home. And again, encourage parents and families to get documentation in, or don't assume their kid has allergies, get a diagnosis that their kid has allergies. I will toss it back to Kelly and then address any questions if they come in, but it's been a little bit since we've had a new one.
Sure. Thanks for everything. And just so everyone is aware, the CCDPH press release on masking will be sent out with your handouts. I sent it out last time, so I'll send it out again this time for those who didn't get it the last time. The only thing that I would like to address with the group is on April 1st is one of our scheduled webinars. I know a lot of schools are on spring break that week. So I just wanted to know if you are available to attend the webinar, or is it advantageous for us to talk about canceling due to low turnout with everyone obviously enjoying themselves for spring break. So I just wanted to know if your school will be in is open for that week of April 1st, or will you be in attendance? So we have some, Kelly getting no webinars. I'm sorry. It was going so fast for me to read it. So it looks like a lot of people are in school. So, okay. So we will still continue to have our webinar. And for those that are in spring break, if you register, you will still get the information, even if you did not make the webinar. So I just wanted to make sure that we will be doing the right thing by having our webinar. We don't want to have just Lex and Michelle and I on there talking to each other. So we want to make sure. So that is all for me. If there are any more questions and concerns, you can feel free to email myself or Lex or Michelle. And enjoy this weather. It should be 70 degrees tomorrow. Very exciting. And I think on Sunday as well. So if there are no more questions, we will adjourn and we will see you on March 18th. Thank you all so much and be well.